Dear colleagues, my name is Dr. Michael Weber from Germany. I'm a biochemist and a medical doctor for more than 30 years. Today I want to show you new methods for photodynamic therapy of cancer. Photodynamic therapy of cancer is widely used already in the world for more than 40 years. The principle behind this is using a light-sensitive substance. We call the substance photosensitizer, which we can apply maybe on a tumor from outside as a cream, or what we can inject into the bloodstream, and this substance will accumulate in cancer cells and will make the cancer cell light sensitive. This therapy is approved all over the world, but unfortunately limited till today only to superficial cancers, because all photosensitizers what we are using up to now are derivatives from the porphyrin molecule, either from hem or from the chlorophyll. Arrived from hem we call them hematoporphyrins, or from the chlorophyll we call them chlorines. The problem is that all these photosensitizers can be stimulated only by red light, and the penetration of red light into the body is limited. Maximum maybe 1, maximum 2 centimeters. Photodynamic therapy is regarded as one of the best therapies for cancer because it's not harmful and it stimulates the immune system. So there is a big research going on all over the world to look for better photosensitizers, especially substances which can be stimulated by infrared light, because infrared light can penetrate a lot deeper into the body and also can penetrate bones and even the skull bone. So up to now there is no substance available, but in cooperation with German and American doctors we could develop a new substance which we now can stimulate with infrared light. The name of this substance is indocyanine green. This substance is used for more than 50 years all over the world, mostly for fluorescence diagnostics, for heart, liver, or other diseases in angiology. It is a wonderful photosensitizer which can be stimulated by infrared light, but normally it will not accumulate in cancer cells. So we had to find a way how we can bring it into cancer cells. Normal indocyanine green leaves the body normally after 30 minutes already and will not accumulate in our tumors. The new way that we found is a better drug delivery system in so-called nanoparticles. Yeah, here you see in this picture the chemical structure of indocyanine green and the absorption maximum of 810 nanometers infrared light, so it is really the perfect photosensitizer. How can we bring it in the body and how can we bring it in tumor cells? A new option for improved tumor targeting and uptake is the formulation in so-called nanoparticles. So in this picture you can see different kinds of nanoparticles. In case of the ICG indocyanine green, we put it in liposomes. And in this picture you can see the targeting into tumor cells, because tumor cells have an enhanced endocytosis. It takes some time, but after 2 or 3 days there is a maximum accumulation of the substance in tumor cells. You see it in this picture, and the maximum after 5 days, and it stays up to 2 weeks in the tumor cell, so with that we have nearly a week or even more time to treat this tumor every day with infrared light. So first of all, if we stimulate the indocyanine green with infrared light, we produce oxygen radicals, and the oxygen radicals will destroy cancer cells. We know that cancer cells are more sensitive to heat, so therefore also we work with hypothermia. I think you know this. So there is an additional effect to the photodynamic effect, as a so-called overheating effect. So besides the oxygen radicals, also we increase the temperature in the tumor tissue up to 3 degrees in comparison to placebo, which leads to a huge depression of tumor growth. In this picture, you can see the substance is a light green substance. This is the ampoule what we are using. We are using normally 75 milligram liposomal indocyanine green, and we dissolve this substance in 250 milligram saline solution, and then we infuse it over 30-45 minutes into the body of the patient. After this, we already use ultrasound methods like shock waves and low power ultrasound to target the substance in the tumor cell, and normally after 2 or 3 days we start the treatment with infrared light irradiation. And we can do it in 2 ways. One way is the irradiation from outside, maybe if it's a breast cancer, but still the penetration is limited. So to improve this, we put fiber optic needles, that means needles with sterile fiber optics, close around the tumor to overcome the resistance of the skin, and then we treat the tumors with so-called interstitial photodynamic therapy with infrared light. And additionally, we stimulate with ultrasound. We use low power ultrasound and ultrasound shock waves, because also ultrasound, additionally to light or laser light, can stimulate the substance for production of oxygen radicals, for production of so-called cavitation bubbles, which lets the tumor cells explode. So this is the new way what we are using. We are doing this every day. We treated already some hundreds of patients, and the results are really very, very promising for the future. Thank you very much.